everyone. Thanks for joining us today for another Grace Live conversation. We're really excited about tonight's topic. A little bit about Grace. For those of you who don't know, Grace stands for Godly Response to Abuse in the Christian Environment, and we really work to equip the Christian faith community to better recognize, prevent, and respond to abuse. Our focus initially started very much with child abuse, and we still have a large focus with child abuse, but we also look at other forms of abuse, whether it's spiritual abuse, abuse of power, harassment, or other forms of misconduct, and really work with faith communities in a preventive way through training and policy review, as well as in an institutional response manner through assessments and consultation. So that's a little bit about who we are. And as part of that, we often have Facebook Live events about once a month. And today's topic, such a powerful and important topic, is understanding the physical impact that abuse has on a person's life. Both the immediate physical impact that might occur, but also the long-term physical impact that can occur when abuse occurs. And we have some incredible guests with us today, Dr. Nancy Harper, Rebecca Foell, and Shelly Magnuson, to help us better understand both the physical effects of abuse, but then also what we can do about it. Did you guys want to say just a little bit more about yourself and about the program where you work? Because I think that it's so amazing, and I think would benefit from knowing more about the work that you're doing.
Oh, absolutely. I'm Nancy Harper. I'm a pediatrician, and I'm also what's called a child abuse pediatrician, which means that I did additional subspecialty fellowship training in child abuse and neglect. So just like you can have a pediatric cardiologist who just specializes in heart disease in children, I specialize at this point in child abuse pediatrics, and I'm the director of the Center for Safe and Healthy Children at the University of Minnesota. And I'll turn it to my colleague, Rebecca.
Yeah, my name is Rebecca Foell. I am the program coordinator for the Otto Bremer Trust Center for Safe and Healthy Children, and my background is a social worker. And we'll talk to you a little bit more about our program as well.
And hello, my name is Shelly Magnuson. I am a child life specialist, and I came to the center about a year ago, and I'm working to navigate the developmental concerns that the children encounter at our clinic.
Real briefly, the center is really here to provide medical and psychosocial services to children and families who have experienced any form of abuse and neglect. That could be physical abuse, could be sexual abuse, could be neglect, could be many other things as well. We provide services to children and families, both inpatient and outpatient in our clinic. And we have a care model of services where we provide clinical excellence as well as advocacy, research, as well as education. And as a social worker, I'll just tell you our role is to really work with the family as a whole and do that comprehensive psychosocial assessment of the family and work with the caregiver while the medical examination is occurring with the provider. And that's to assess for risk factors, protective factors, and really to make sure that that family feels supported and has the resources that they need.
And I can jump in as a child life specialist. I want to make sure that the children are well prepared for what to expect. And I will talk with the caregivers as well and kind of explain the flow of our clinic. We emphasize there's no surprises. The children will have choices along the way. And then we really want to emphasize that we can incorporate a coping style that works specifically for that child to help them with their visit. And then at the end of the appointment, we help identify resources that are specific to that child's age and developmental level that the parents can take with them when they leave.
Because our goal in our clinic here is to make sure that we provide an experience for the children and the families that's trauma sensitive to the child's age, development, cultural or national origin needs. And so we try to make sure that that's all sort of blended into the clinic experience here for kids. And we call that our sort of child-focused approach, or as we say, the child takes the lead. One moment. There we go. The other thing I'll say is that the clinical experience here, that medical clinic, is just one facet of the work that we do. So we also provide quite a bit of education here, not only education for children that we see and their families, but also for our health partners throughout the system, because here at the Center for Safe and Healthy Children, we cover a large healthcare system known as mHealth Fairview in Minnesota. We also cover our trauma partners in the county, known as Hennepin Healthcare, and of course, other smaller hospitals and clinics in our community. We also provide education for our community partners that include therapists, educators, social workers, child protection investigators, law enforcement, attorneys. We do that both through focused, small trainings as well as large trainings that we do annually. And then another thing that we do is provide education for the physicians in training here at our hospital system. So whether they are physicians training to be pediatricians, emergency medicine doctors, and we also run a fellowship program where we train pediatricians to be child abuse pediatricians as well. And of course, as part of our job, I end up, and some of our providers end up providing testimony in court as well when we see children who have been victims of child abuse and neglect.
Wow, you guys are doing some incredible work. I love the holistic approach that you bring to it, the way that you're able to really work with the child and family to meet the needs of the whole person and to do it in a way that understands how trauma impacts each and every person in that family. Thank you very much for the work that you are doing. I know that it makes an incredible, incredible difference for the kids and the families both. As we head into our discussion today on the physical impact of abuse, one of the terms that I hear talked about very frequently related to the physical impact of abuse is ACEs, or adverse childhood experiences. I'm wondering if you guys could give us a little bit of background on ACEs, adverse childhood experiences, but also another thing that in our conversations prior to this, you had brought up positive childhood experiences. Can you give us some background on both?
Absolutely. I think really addressing these ACEs kind of gets to the core of the work that we do here. And really sort of to simplify things, an ACE is a potentially traumatic event that occurs in a child's life before they reach the age of 18. And we know that when children and adolescents are growing up, that is just such an important time for them in their development. They're developing their brains, their bodies, who they are. And so it's just a time where they're really being shaped. And so we know if there is exposure to prolonged or negative experiences, that is going to have an impact on how they are as they continue to grow up and go through different developmental stages. So this work really took place in like 1995 to 1997 through Kaiser Permanente, and together with the CDC. And what they did was basically examine the association between ACEs and the physical health of people. And so what they were able to see is that the more adverse childhood experiences one had, the more likely they were to experience some of these issues. Some of them, for example, might be, things like depression and anxiety and substance abuse. Then there were also some things that have to do with like their medical care and how they are doing physically.
Right. And what was really surprising is that, ACEs are really common. In fact, they found out that as many as 2/3 of adults have at least one adverse childhood experience that they can recall. And then sadly, 1 in 8 adults have 4 or more adverse childhood experiences. And what they found when they researched some of these medical and psychological health outcomes is that if you were an adult who experienced 4 or more ACEs, that you had an increased risk to have 6 of 10 sort of leading causes of death. Really frightening, that include things like heart disease, chronic lung disease, stroke, even things like diabetes or the risk for attempting suicide. Those were all seen Other studies also showed that you may have a shorter lifespan. And in children, we saw that it actually could affect them in terms of their development and their learning, as well as their growth, and also, of course, their ability to sort of learn and function in school. So we know that there's some of these sort of really significant, possible outcomes for children, but they can be prevented and they can also be buffered. And so we're going to talk about that a little bit today, about how ACEs paints this picture that seems really frightening and negative, but you have to balance that with those buffering relationships that children have, those community supports and positive experiences.
And for your listeners and those who are wondering, so you can actually go online and take an ACE survey and see what your ACE score is. They divide it up into 3 categories. One is abuse, and that includes emotional abuse, physical abuse, and sexual abuse. And then household challenges, such as domestic violence, mental illness, maybe incarceration of a parent, even divorce is on there as well. And then neglect, whether that's emotional or physical neglect.
But haven't they also even expanded the ACEs now?
They have expanded it.
Yeah.
So there are even, like, for example, corporal punishment is now considered an ACE. So there's just all these different ones that are being added.
Or exposure to community violence, like we've experienced in Minnesota this past year for our children. Or the isolation of a pandemic like COVID-19.
And when we talk about a score of like 4 or 5 or 6, it's on a scale of 11 now?
I think it's 11 now,
Okay,
yes.
so
Yeah.
a reference point.
Yes,
Yep.
exactly. But I think, back to kind of what Dr. Harper was saying about these positive childhood experiences, it's really important to remember that there are ways to buffer these adverse childhood experiences. We don't want people to see their score and think, oh no, I'm doomed. I'm going to have a horrible life. I'm definitely going to get sick. I'm going to die before I should.
Right.
That is really not the case. Not only are there things that can be done to prevent ACEs, but there are things that can be done to mitigate the effects of ACEs. And so I'll let you kind of talk a little bit about some of those positive childhood experiences, Shelly, but I think it's really exciting because it's new information that's starting to come out.
Right. And I think when we're working with our families here in the clinic, sometimes just reminding them what they're doing at home is helping these create these positive experiences, such as providing a safe, stable environment, providing a loving relationship with their child. But there was a study that came out of Johns Hopkins, and they identified 7, I believe. It was 7, we call them positive childhood experiences. They can also be referred to as protective childhood experiences. And so that would be the ability to talk with family about your feelings, having a felt experience that family is supportive during difficult times, having enjoyment in participation of community traditions, feelings of belonging in high school. These are things that I think a lot of us can relate to, but they have really pinpointed that these are like their 7 things. Another one is having at least 2 non-parent adults who genuinely care about them. And so you think of like teachers, or you think of people in the church community, and finding those safe adults. And then lastly, they identified feeling safe and protected by an adult in their own home. So those were the 7 that Johns Hopkins identified.
Yeah.
Wow, those are powerful. And they're things that we can do in our homes. They maybe don't require a whole lot of extra resources or extra special parent training, but it's really just forming that attachment and that connection with our children.
And that's true. And in fact, that's one of the messages that we often give to parents when they're talking with us about their children, that the most important thing that they can do to help heal trauma in a child is just being that nurturing, wonderful caregiver. Those safe, stable, nurturing relationships are what can really have the most powerful effect on the toxic stress of early life adversity.
Yeah, the caregivers that we work with often feel so much guilt about what happened to their child. They wonder how they maybe could have prevented it. And so it's nice that we have this opportunity to give them that reassurance that, this, first of all, wasn't your fault. But second of all, here are things that you probably are already doing. And if not, here are things that you can adopt, and they're really going to help your child do well, despite the adverse childhood experience that they had.
Right. And that really hammers out this other study that we had talked about just this week in our clinic. We were doing a journal club, and the article found, it was out of Brigham Young, and it found that regardless of the number of ACEs, positive childhood experiences can protect against poor health and promote better health and well-being throughout adulthood. So having those positive childhood experiences, regardless of the number of ACEs, can still predict a healthy outcome in adulthood.
That's so important, because we need to know the consequences that abuse has in a person's life. And that's why we're having the conversation around the physical impact. But so often that conversation can just really be overwhelming and depressing without a clear pathway of hope. And as you bring in those positive childhood experiences, you're laying out a clear pathway of hope. And that is so important, that we don't lose hope, that we see that path forward.
And I find also that so much of what our school systems offer these children is so many of these building blocks for positive childhood experiences. And so I think we have talked about that too, on how this past year has especially had an effect on children with the limited access to school and stable environments, and, you know, even consistent meal times and all the things that got thrown out this past year.
There's a website that's called ACEs Connections that has a ton of really good information about adverse childhood experiences. One of the things that it talks about is the 3 realms of ACEs, and that includes, might need your help, household, household, community, and environmental.
Yes.
And so if you think about this time in our lives, our families have been experiencing all of these. So if you have a child, for example, who has experienced child abuse and neglect, that's the household one. Community, you talk about, you know, some of the issues that we've been having with civil unrest,
right,
and other things that have been going on, particularly in Minneapolis where we live. And then in terms of environmental, we've all been dealing with COVID-19. And so we are seeing families who right now are really experiencing layer upon layer of trauma. And so anything that we can do to help to buffer that is really so important.
Yes, absolutely. Absolutely. So those buffers are super important. As you think about some of the work that you've done with kids that are coming in having experienced abuse, what are some of the ways that you've seen those kids impacted physically?
Oh gosh. So of course we've seen children who have been victims of physical abuse. So sadly, we see children as young as babies who have bruises, who have broken bones or fractures, who have injuries inside their bellies, their abdomens, to their brains. We see older children with injuries like this as well. And as we talk about, these physical injuries do heal. And then of course we worry about how that might affect a child's development, their learning, as well as their psychological health. So one of the most important things that we do here when we see children in our clinic, once they're old enough where we can actually have their caregiver sort of complete a survey on their symptoms of traumatic stress, but we assess these children for some of these other psychological symptoms that we may see as a result of that sort of physical consequence of child abuse and neglect. And I think that's really important. And, you know, Rebecca could talk a little bit more because this is really sort of a new program and we've now gotten funding to help expand it through Minnesota as well.
Great.
Yeah. And so we, ACEs are so important, right? Of course, but we know that the children and families that we see have experienced ACEs. And so there's a lot of people who are screening for ACEs, which is wonderful. What we decided to do was kind of take it a different step and to really kind of look to see what their traumas symptoms were and how much they were being impacted by the traumatic stress that they had experienced. And so we asked these kids via paper or iPad a series of questions that really get at whether or not they're experiencing symptoms of trauma. Are they having a hard time sleeping? Are there issues with hyperarousal? Are they avoiding things that remind them of what happened to them? And then we take all that information and they actually get a trauma score. And so we see how much they're physically and emotionally being impacted by that trauma. And then we provide them, of course, with referrals and resources so that they can get the therapeutic services that they need, but also with an intervention that we do with them in the office.
Which is the really cool part.
Yeah, it's the really cool part.
It's really fun to watch.
Give them some options for managing those symptoms. And we do them with the caregiver present so that the caregiver can learn them as well. And
they can practice together. Yeah.
Exactly. We know that the caregivers of the children that we see often have their own trauma history as well. And so we're giving them tools that they can use independently and together, and that they can take home with them, which is wonderful. And Shelly can talk a little bit about some of those interventions.
Right. It is really wonderful to come together and then talk with that parent about ways that they can take these home and support their child, and for their child to know that, oh, my mom's hearing this too, or my caregiver, so that they don't have the weight of trying to remember all of this by themselves. But we offer things like therapeutic journaling and talk about the benefits of using journals to kind of put their thoughts in a spot before they go to bed at night. We often see children who have problems sleeping or staying asleep. And so giving them techniques like that for therapeutic journaling. We have breathing and relaxational strategies that we practice with children. And adolescents, we do things like square breathing.
We should demonstrate square breathing because perhaps your listeners who are listening and watching can do that as well with us, because it's really powerful. It can lower your blood pressure, your heart rate.
Right. It's just if you can envision a square and you're going to start at the bottom corner, and I'm going to actually draw a square on my hand. It's also helpful to draw a square on your leg, on your arm, and that just pulls in some of the other senses. It's pulling in vision, it's pulling in the sense of touch, and that helps you center yourself even more. So I'm going to start at one of the corners. I'm going to breathe in for the count of 4. 1, 2, 3, 4. Now I'm going to turn the corner and I'm going to hold that 1, 2, 3, 4. I'm going to breathe out 1, 2, 3, 4. And then I'm going to just hold that again, kind of pause and for a count of 4. So you breathe in for 4, you hold it for 4, you breathe out for 4, and you hold it for 4. And that makes the 4 sides of your square. And when you can pull that into other senses, like I mentioned, it is a grounding and centering activity.
And so I think, we really know that there's such a connection between our physical health and our emotional health. And so doing some of these things really helps provide those coping skills that will help them emotionally and physically. They're completely connected. And so that's why we do that for the kiddos and the parents that we see.
And then just some of the other concrete resources that we have all kinds of books for ages, all ages of children and adolescents, of ways to stay safe in your community, ways that parents can recognize stress in children, especially young children who might not be able to have that verbal conversation with their child, with their parent about how they're feeling. So we look for things like, is their child's eating patterns changed? Have their sleeping patterns changed? Are they having wedding accidents? Are they having a lot of tummy aches, a lot of headaches? And so we give the parents some of those resources on how to recognize stress in young children.
Well, and even just great books for kids that are developmentally and age appropriate. Reading to a child is an incredible positive childhood experience. And that's really simple to do.
Right. Yeah, we've partnered with Reach Out and Read program. And so just getting some normalizing books into the hands of these families and encouraging that reading time together, that bonding time together.
That's great. I love the combination of the coping strategies. 4 square breathing is one of the most common skills that I help kids learn when I do therapy. And so, yeah, just seeing the power of that, as well as those positive experiences. You were talking about them earlier, and you're working to equip families to have those with their kids, and some of the practical barriers that might be there. Being able to afford books can be a definite barrier for people. And so to help provide those books, those are all incredible. tools.
When the children leave here, they leave with a pillowcase full of like books and, you know, other items, clothing, jackets. We use very colorful and age appropriate pillowcases in the exam room with a pillow that, you know, you use during your medical exam. And Shelly has gotten great donations. And so the children get to take home their pillowcase from that day, their blanket, as well as the books,
Wow.
journals, and other resources that we've identified.
And we do try to normalize the environment as much as we can. We don't want them to feel like they're walking into a sterile medical environment. And so we have toys out, we have coloring activities, even while they're going into their checkup. If they're not done with their art activity, they bring it with them when they meet with the provider. And it just helps with us to engage with them and build rapport with them, but it also is something they can relate to in an environment that's not as normal to them.
Wow, that's great. That's great. Just to take an experience that has the potential to almost be re-traumatizing and to instead make it safe and welcoming and a source of that healing, and being even just able to bring home that pillowcase. That's so wonderful. That's great.
That is actually, I'm glad that you said that, because that is actually a myth of medical examinations for children who have experienced abuse and neglect, that they are re-traumatizing. And so anything we can do to dispel that myth, I think, is really important. We do everything we can to make sure that the child is in control of the appointment, but that it's an opportunity for them to make sure that they are safe and healthy. The other thing that I just want to point out is that we are by no means saying that trauma and child abuse and neglect is something that can be easily addressed. This is something that these kiddos carry with them throughout their lives to varying degrees that will kind of show up differently depending on their developmental stage. And so it's really important that they also leave us with some important referrals for some interventions like trauma-focused cognitive behavioral therapy, play therapy for the younger kiddos, therapy to help with attachment, because that attachment piece is so important. There are modalities such as EMDR. There are all sorts of different interventions, and we want to make sure that our kiddos leave here and have a place to go for therapeutic services. That's really, really important.
You know, I think it's also a myth that there isn't therapy for young children. There is evidence-based therapy. And if you're a therapist as well, Pete, you know that there's therapy such as child-parent psychotherapy that goes down as young as, I think, 6 months of age. So there are different therapeutic strategies that have evidence behind them that work for children and families.
And we're seeing these families in one snapshot of their life. And we know that children process trauma differently as they progress through different developmental stages. So how they're processing this as an 8-year-old is going to be a lot different than how they process this as a teenager. And so having, like Rebecca said, these resources that can follow them out of this clinic visit are very important.
Yeah, that's great. That's great. It is important because, like you said, how they process will change over time. And often it's not just, okay, we'll come in, we'll treat you, we'll maybe talk to you a couple of times, and then everything will be fine. It's that follow-up and being able to support the family ongoing. Those resources that you give are so important. A lot of the things that we've talked about are the ways that we can support a family or support the child. But a number of our listeners may have had an adverse childhood experience or multiple adverse childhood experiences, and now they're an adult. So they can't really go back and develop a safe and supportive childhood relationship because they're an adult. Are there things that an adult can do to offset some of the risk from those adverse childhood experiences that they may have encountered as a child?
Oh, I mean, absolutely. Again, this is not a doom and gloom. There are definitely things that can be done. It is never too late to get therapy and to engage in therapeutic services. We encourage the caregivers that we work with to get involved with therapy themselves all of the time. And a lot of times when an adult has experienced trauma and then their child experiences trauma, that can be re-triggering for them. And so we really encourage them to get into therapy for themselves and then also for their child, because that, first of all, models that therapy is a good thing, but also allows them to parent them as best as possible. And then participating in those wellness activities like exercise, good diet, doing some of those mindfulness activities and meditation. The square breathing, I mean, we joke, but like this stuff works for us and it should work for the caregivers as well. These are all things that are healthy and that we should be doing. Of course, getting regular medical care and then participating in support groups and any kind of community involvement that you can think of. For the families that we work with, the children, one of the most important things for them is to make sure that they are validated, that they know that what happened wasn't their fault, for a loving person to say to them, I'm going to protect you, I'm going to keep you safe. And a lot of times adults never had that when they were growing up. And so we really want them to develop healthy relationships where they start to get those messages as adults. And so whether they do that through a therapeutic relationship or through community involvement, churches, whatever it may be, it's really important that they form those healthy relationships as well.
And I think it's also important to remember to, as the parent, treat yourself with kindness and grace. It's hard to be a parent. And we have to remember sort of that analogy of putting on your own oxygen mask, that as a parent, you will be more effective, have a better nurturing relationship with your child if you do take some time to take care of yourself. It's okay to take care of yourself. And so I think that's an important message to sort of pass on to the parents out there who have experienced trauma themselves. Absolutely.
Yeah, that's so cool. I think one of the most heartbreaking experiences that I've had is when I was working with a family. The mom had been abused as a child, and she had just found out that her 5-year-old had been abused by somebody in their community. And she was so devastated. This mom was feeling like she had failed to protect her child. But to be able to then help her realize the reason you found out is because your child came and told you.
Oh, absolutely.
Your child came and told you the first time anything happened, because you had established that relationship with your child and you had made clear that your child knew they could talk to you. And so I think, like you were saying, to help the families and the parents recognize that they aren't to blame, and to see the things even in such a horrible experience that it's not your fault and you have done things well. You have done things to protect your child is just so incredibly powerful. We're getting close to time. So I guess the last question that I would have is, as a parent, how can I best partner with my child's medical team? And then part 2 of that question would be, as a church or a ministry, what are some things that the faith community can do to help address the health impacts of abuse?
I mean, I can start with the second one. I think for me, the most important thing is being a safe place. I mean, all of these things that we're talking about today are it's so important for us to know that we can go anywhere and they will be trauma sensitive. So for you guys to be an environment for families who may not have grown up with somebody who gave these messages to them, such as, I believe you, it wasn't your fault, I will keep you safe, we are here for you, you are not alone. Those are the things that are going to help people succeed and do well and heal. And so if they didn't get it in their home growing up, maybe they didn't get it in their community, maybe they didn't even get it at school. for you guys to be that environment for them, I think is really, in my mind, the best thing that you guys can do for children and families.
And the fact that, you know, the church provides these strong sort of relationships for adults, that they have nurturing relationships to help them heal as well as the other ones for children, I think that's pretty powerful.
And even when you look at like Sunday school programming and how you have all the 5-year-olds together in one room and you have the teenagers together, they're building a sense of community, and they have a group of peers that they can relate to. So,
And trust.
exactly.
Yes, trust is so important.
In terms of partnering with your medical care, I think that's first off, making sure that you feel comfortable with your medical provider, especially if you've experienced trauma. Remember, you know, it should be a good fit. If you don't feel comfortable with your medical provider, try to find a different medical provider. You want someone that's sensitive to your trauma history, that doesn't say, tell your child that they have to be examined today, that they have to take a look at, say, their genitalia today, that a child has some choices in the exam so that they feel like they're in control. So you want that relationship that is positive for your child as well. And then make sure that you do those regular annual well visits. People sometimes think my kids are healthy, I don't need to take them for the regular checkups, but it's a great time to talk about your child's, you know, psychological, developmental health when you're just there with your healthy child for their annual visit.
Especially with teenagers, I want to add on that.
Yes.
And that teenagers can start to build a relationship with a healthcare provider. We'll just lead them on a path of feeling comfortable in that setting, you know, lifelong.
And I think, remember that children are watching you. So you're their role model. So you engage with your healthcare, you take care of your body, you recognize that your body and your mind are totally connected. So emotionally and physically, you need to be healthy, because they're going to learn that from you.
Wow, that's great. That's great. I especially loved what you said about empowering the parent to seek the best doctor for their child. A
And
doctor
for themselves too. Yeah.
Yes, and for themselves, a doctor that understands it. I think sometimes as parents, we maybe feel like we don't have that power, but I love how you were so clear that the parent can take that power and that that is okay. So that's great.
We had a question I thought was really good. Can I share that with you?
Absolutely.
So this was from one of our commenters asked, are we allowed to ask a doctor's office if they are trauma sensitive?
Yeah,
That's a
I think
great
that
question.
is a very valid question. And I think that if they don't have an answer, then they probably don't know what being trauma-informed and trauma-sensitive is. That is basically, it's more than just knowing what trauma is. It's empowering, like, parents, children, whoever the patient is, to have choices at the visit, to sort of help guide their medical care that day and say, gosh, today I feel comfortable doing X. I don't feel comfortable doing Y, whether that's part of their testing that day that's been recommended, part of the examination. And so I think that's a very valid question, very valid question.
I do too. And I also think that,
I can type on our website, pass me.
oh, sure. I think you will also know, you will get there and you will be able to experience pretty quickly whether or not you feel like that is a trauma sensitive environment for you. And I would just encourage and empower you to say, like Dr. Harper was saying, this isn't for me. This doesn't feel like you're focusing and understanding my trauma, because that is going to be such an important part of your medical care.
Wow, that's great. So part of advocating is to ask. That's wonderful. And it looks like you have your website that you just put in the chat. Was that your website?
Yes.
Perfect. So that would be a great resource for people to look through. And so one, you can ask, but then you can also perhaps do some research on your website and find out what some of those things might be that you're looking for as a parent seeking medical care for yourself and your child that actually understands this, that actually gets this. So that's so important. For faith communities who are looking to be able to take steps as well, I want to mention that coming up on June 28th and 29th, there will be a 2-day conference called Keeping Faith. It's a virtual conference that you can sign up for. You can go to the Zero Abuse Project and sign up there, and that would be zeroabuseproject.org. I'll be one of the presenters there, as will Victor Veith and Allison Fay. So I'd really encourage you to check into that conference if you're in a faith community, if you're a leader in that faith community, to learn additional ways that you can help protect kids and make churches and ministries a safe place for kids and a healing place for kids. Thank you again for joining us today. We've just really benefited so much from your wisdom, from your experience. Thank you also for all that each of you do for kids and the tremendous difference that you make for them and for families during really what is probably one of the most difficult times of their lives. You are truly making a difference, and I thank you very much for that.
Thank you for inviting us
Yes,
today. I
thank you
mean,
for having
gosh,
us.
this has been such an honor and a privilege, and it is our first Facebook Live event.
Whoa!
Yeah.
We've ushered you into a new era of technology.
Absolutely.
Thank you.
Great. In July, we'll be having another Facebook Live event, and our focus will be on safeguarding. How do we preventatively work within churches and faith communities to prevent abuse from happening in the first place? Our guest will be Mike Sloan, who's our Director of Safeguarding here at Grace, and we'll be able to speak from his vast experience and the work that he's done with many, many churches and faith communities to help make them safer places and places of healing. Thank you for joining us. We hope to see you in July, and if you get a chance, and visit our website at netgrace.org. That would be great. You can find out more about Grace as an organization, and there's also a donation page there if you feel so led. Thank you very much.
Thank you.
Thank you.
Bye.
Bye.